So good morning, everybody, and thanks for being here. And I want to especially thank the Walmart Regional Health and Wellness Director, Jamie Riley, for being here. He's going to say a few words in just a minute. And as you know, Walmart is one of the key testing partners for Pennsylvania. They've been operating drive-through testing center in parking lots, I think at 13 locations, especially in rural communities. And they're part of the total 400 and what are we now?
445.
445 testing sites across the state. And we're continuing to build our testing capacity, and we need to do that because we know that rapidly identifying and isolating people who have been affected with COVID-19 is a key part of reducing the spread of this deadly virus. Testing is key. And so partnerships like the one we've established with Walmart and with Quest Diagnostics has helped us expand testing into many communities across the Commonwealth. Again, the issue is not just how many tests you have the capacity to do, but it's how accessible those tests are, how easily people can get to them. At the height of the first wave of COVID-19 cases in April, our statewide capacity in April was under 8,000 tests per day. That was back in April. We're now averaging around 22,000 tests daily, and we're testing about 4% of our population each month. While more testing does increase our total number of positive cases, identifying carriers of COVID-19 is a really important part of eliminating this spread. Our test positivity rate is slightly below 5%, which is a level that the CDC and the World Health Organization say that indicates an appropriate level of testing even as our new case counts remain relatively stable. But we have been experiencing delays in getting Pennsylvanians their test results due to national labs becoming overwhelmed by the need for testing in states that are experiencing a major outbreak. And I think the federal government has actually been making sure that some of these other states get priority in the national tests. We're because of our record, we're actually, knock on wood, continuing to do better. We're not at the top of that list. So issues like this really show that no state is an island. We all are in this together when it comes to a viral pandemic. And it emphasizes, just again, how nice it would be if we had a national strategy, especially when it comes to making the best use of our testing capacity. Here in Pennsylvania, we're doing what we can, everything we can, to expand our testing capacity and get test results into the hands of patients as quickly as possible, understanding the challenges and the hurdles we have to surmount to get to that. For example, we know that some hospitals and smaller labs have been unable to use their maximum testing capacity due to a shortage of reagents. This is not just the numbers. They actually don't have the stuff they need to actually do the test. So Pennsylvania's working with large manufacturers to send reagents to Pennsylvania, which is allowing us to get more test results done through our labs, even if the national labs are backlogged. We're also continuing to make use of the Commonwealth lab, which is in Exton, Pennsylvania, especially for high priority cases, such as when an individual may have exposed many other people. And we're turning those tests around within 24 hours. 24 to 48 hours. Overall, Pennsylvania's response to COVID-19 has been appropriate. Our healthcare system has not been overwhelmed so far. The 14-day average of hospitalizations has dropped from 1,028 patients in early June to close to 700 at the end of July. And Dr. Levine will give you the update as of the number yesterday. The 14-day average number of COVID-19 patients on ventilators has dropped from 222 in June to 94 at the end of July. We're going to continue to build up our testing and contact tracing capacity so that we can continue to aggressively mitigate COVID-19. But even with the growth of these programs, we still need Pennsylvanians, all 13 million of us, to do our part to reduce the likelihood that others are going to contact or spread COVID-19. So especially during this time of national testing shortages, what's been true in the past remains true. We have to wear a mask in public. Thank you all for wearing a mask. We have to wash our hands frequently. We have to avoid crowds and gatherings. And that means we have to stay away from loved ones if we think we're sick and we don't want to spread this disease to someone who might be susceptible. As I've said many times, we all have a part to play in getting through this pandemic with the best possible outcome. And in just a minute, we're going to hear from Jamie Riley and hear how Walmart is contributing to our effort. But first, I want to turn things over to Dr. Levine. So, Secretary Levine, it's your turn.
Well, good morning. Thank you so much, Governor. Here's our latest update on COVID-19 in Pennsylvania. As of 12 a.m. this morning, we have 807 additional cases of COVID-19 that have been reported. This brings our statewide total to 116,521 Pennsylvanians who have tested positive for COVID-19 in all 67 counties since the beginning of the pandemic. Tragically, 7,282 deaths have been attributed to COVID-19. As the governor said, testing is vital to ensuring our safety from COVID-19 during this global pandemic. Our partners at Walmart are playing such an important role in helping us stop the spread of this virus. Walmart has helped us expand testing in many areas, including specifically rural areas of Pennsylvania that may not have easy access to hospitals or other medical facilities. We are making great progress on making those tests available to those who need them. According to data from the CDC, Pennsylvania is 9th in the nation in terms of tests completed. We're somewhat less in terms of per capita, but we're increasing our number of tests every day. As the governor mentioned, we're now averaging nearly 22,000 test results per day, and we're testing approximately 4% or more of the population each month. If you need to be tested for COVID-19, there is an interactive map of testing locations on our website at health.pa.gov. And as always, if you have questions about your health, please contact your healthcare provider. Getting a test is an important way to stop the spread of the virus COVID-19. In addition, as the governor mentioned, you also work to stop the spread of COVID-19 when you wear a mask. And you stop the spread when you use hand sanitizer and wash your hands frequently. And you stop the spread of COVID-19 when you avoid large public gatherings. And what is most important for Pennsylvanians to remember always is stay calm, stay alert, and stay safe. And now I'd like to turn things over to Jamie Riley, representing Walmart.
Thank you, Dr. Levine. So good morning, everyone. First of all, again, thank you for being here and for allowing me to have the opportunity to speak to you today. So again, my name is Jamie Riley. I'm a Walmart associate, Regional Health and Wellness Director of Operations. As most of you know, Walmart, currently operates in communities all across America, and 90% of the population lives within 10 miles of a Walmart. We've been in the health and wellness business for over 40 years, serving both pharmacy and optical patients, and in recent years have initiated screening events to become a community well-being center around screening for diabetes, cholesterol, other disease states, as well as offering services around nutrition and other values. Now with that, we know it's critical that we can play a vital role during a community time of community crisis. As an organization, we are extremely committed to supporting the efforts around COVID-19 testing through partnerships with both the federal and state governments, labs, and ultimately insurance companies. From the beginning of the outbreak, when we were asked to step up, our goal was to provide increased access to testing in communities and playing a part to help combat the pandemic. Currently, our goal is to continue in just that, and we have the opportunity to work with the state of Pennsylvania in continuing on our initiative to expand testing, as Dr. Levine mentioned. So what we're going to do now is play a brief video so you can look at the overview around what a specific drive-through parking lot model looks like in Elizabethville, Pennsylvania. So this site will be active tomorrow, and currently went through dry runs yesterday to training around the site specifics, and we'll active tomorrow to the open to the public. And we'll talk a little bit about after the video of how those individuals who are interested in being tested would enroll for the process.
not open it until you get to the next stop. And then you want to keep your window up as well when you get there. And they'll walk you through. Go ahead and proceed.
To the mark on there, I'll let you know when it's in far enough to rotate it 2 times. Left hand on the left side, and then hold in place for 15 seconds. And then we're going to withdraw it, place the right hand, right nostril, rotate, hold 15 seconds, and I'll let you know when that's complete.
So as you can see in the video, it's a patient-administered swab, self-swabbing assessment. And as of July 31st, across the United States, we've opened greater than 400 of these sites supported by Walmart. Specifically, as the governor mentioned, we have 13 active sites in the state of Pennsylvania, following the reopening of additional sites tomorrow. So with that, there is no out-of-pocket cost for those individuals being tested. The state is assuming the financial cost for the testing efforts. And with PA specifically, we are working with our lab partners at Quest Diagnostics. So Quest, through their portal, is involved with screening the patients based on CDC and HHS eligibility criteria for testing, as well as scheduling the appointments via their portal. So again, an appointment is required for testing. After the collection process that you just saw in the video, they process the samples and lastly, deliver the results to those individuals who have been tested. For those who want to be tested, it's www.myquestcovidtestpa.com. So again, www.myquestcovidtestpa.com. A few things to note. We are asking those to be being tested to wear a mask. So for the safety of our associates as well as those individual patients being tested, we ask that they wear a mask. You see it's a contactless approach with the model by design, but in extenuating circumstances, we want to maintain that safety guidance. Also, if a patient thinks they are unable to self-swab, we do ask that they bring someone with them to physically do the swab assessment. Because it's contactless, we provided the standard around being assisted. We've been very successful in doing that. And because the pharmacies or the pharmacists are there to maintain the quality of the assessment, if they feel that they don't get a good quality sample, they'll guide those individuals to other means of testing. So we know testing is important. And again, our goal at Walmart is to play a role in supporting in any way we can to make it easy and accessible for those areas in need. So speaking on behalf of myself as well as Walmart, really honored to be a part of this effort. And again, I'd like to say thank you to Governor Wolf and Dr. Levine, and also our partners at Quest, in addition to the hundreds of volunteers and associates across the state of Pennsylvania who are supporting these efforts and ultimately our communities. Thank you.
Thank you, Jamie. Any questions for any of us? Yes.
Can you describe, we've talked a lot about PCR tests and antibody tests. Can you explain whether there are antigen tests, separate the rapid tests? And
Sure.
how are they being factored in? And
Sure. So there are tests for the virus itself, and that primarily are the PCR tests, polymerase chain reaction tests. It's testing for the DNA of the virus. And that is the predominant test that is being done throughout Pennsylvania and throughout the country. Antibody tests are completely different. Those are blood tests that are done, and those are testing our immune response to the virus, and those are called antibodies. The clinical utility of the antibody test for each individual patient is not particularly clear yet. So we don't know as much about the antibodies as we'd like to. As we've said all along, it's a novel coronavirus. It's a new virus. And so how long those antibodies last, how robust the immune response is not clearly known. Because we have many complicated aspects to our immune system, you might have decreasing antibodies, but you might still be immune. So there's actually, it's not clear what that means to the individual patient. It is interesting when you're doing population-based surveillance testing, and the CDC has been doing those type of the tests in Pennsylvania and in other states.
I'm asking specifically about antigen.
I know, that's next.
Okay.
So the antigen test is another test for the virus. So that is looking in a different way than the DNA. It's testing for what are called antigens, and so it's a different biology, a different way of doing it. The role of antigen testing is not exactly clear. There are, I believe, two. There might be another one coming, tests that have been FDA approved. We have heard that CMS, the Center for Medicare and Medicaid Services, is going to be sending test kits to nursing homes in Pennsylvania and throughout the country. That's going to be a challenge, and what we're concerned about is the sensitivity and the specificity of those tests, meaning the false negative rate and the false positive rate. So when nursing homes get those tests, we'll be working with them, and we'll be part of the countrywide process analyzing the specific clinical utility of the antigen tests. I think that
Currently, are there any antigen tests?
antigen tests are only included as probable cases, not as confirmed cases. And so they are not, when we have a confirmed case count, which is how we make any decisions, the antigen tests at this time are not included. They're included under the probable category. Does that answer your question? Okay. Governor.
We're at the,
Did you have a question?
yeah, it's for
For
you.
me? I'm sorry. Yes.
Yeah, there was mention that we're at, the 4% figure that was mentioned, you know, I guess it was 4% per month of our population that we're testing now.
At least, yeah.
What is our goal?
Sure.
Where do we need to be percentage-wise, and when do you think we'll get to that?
Sure.
Like on a uniform basis by geography?
Sure. Well, we have gone from 2% to 3% to 4% per month. We'd like to go higher. We'd like to go to more than 5% per month. So we are working to increase our testing capacity statewide. Working with Walmart and other facilities is one way to do that. In addition, we have done, completed all of our testing of all the nursing home patients and staff. We need to work on our retesting of patients and staff for nursing homes. That will be individualized to the specific circumstances of the facility, where it is, how many positives they had, et cetera. In addition, we're working with the Department of Human Services and the new RICP program, those academic centers, on testing all of the patients in all of the other long-term care living facilities. There are 693, I believe, nursing homes, but there's over 1,200 assisted care facilities, personal care facilities. We're working to get that done by the end of this month with the help of the Department of Human Services. But we need to continue to expand testing. We're working with FQHCs, federally qualified health centers, in terms of testing, and of course hospitals and health systems, which do a lot of testing in Pennsylvania. So there's a whole framework to increase testing. This is all diagnostic testing. There are challenges associated with the testing. We had, with Walmart, with Quest and LabCorp, there are challenges getting the test results back quickly enough. Federal government says that they're working with LabCorp and Quest to increase their ability to do that. And as the governor said, there are issues in terms of reagents, and we're trying to source reagents throughout the world.
You mentioned 5%. So should I assume that 5% would, that if we were able to do that, that would be a point where anybody who needs to get a test that could get one? And I mean, would that put us at the point where we can do the adequate contact tracing to
Sure.
make the total cases go to the level that you're going for?
Sure. So there are two responses that we have for the virus at this time as we wait for the development of a vaccine. One is containment, the other is mitigation. So we want to expand our containment efforts. That is the testing, the appropriate isolation of those that are positive, the case investigations and contact tracing that you're referring to, and the quarantining of those that have been exposed. We are doing that statewide right now. Anybody who needs a test can get a test now. What we're concerned about, we have 400 and I think I said 45 testing sites. We want more. The concerns now are the capacity of the hospitals. They could increase their testing if we had more reagents. So we're trying to source reagents. I mean, that's really controlled primarily by those companies and the federal government, but we're going to try to source the reagents. We can increase testing with hospitals, and the lag time getting back results from Quest and LabCorp. That's really, we've called Quest and LabCorp, and we have talked with the federal government, but it's really up to the federal government and HHS to work with Quest and LabCorp to increase their capacity. But we want to continue to expand tests so we can test 5% or even more of the population every month, and we're working steadily towards that goal.
And Walmart is using Quest.
Walmart is using Quest.
Hey, Jamie, can you tell us what your turnaround time in Pennsylvania is right now?
No, if we go by the average of 7 days, but it's give or take.
Why don't you come here because they can't see you.
So again, we go by the average of 7 days, but give and take, based on the demand and outbreaks in given areas geographically, it can take up to 14 days response for turnaround for results. And those, again, are provided by Quest via the portal that the patient would register in to get tested.
Thank you. If I could just make a comment. Thank you. So, I mean, 14 days, I mean, that's too long. I mean, it's clearly too long. And we again have reached out to Quest and discussed it, and LabCorp, another national company, and we've reached out to the federal government, Health and Human Services, to talk about that. What we've been told by Health and Human Services is they're working with Quest and LabCorp and their capacity to decrease that wait time. And so we will be continuing to reach out and do whatever we can to accomplish that.
Speaking of HHS, the Secretary recently said that he thought that states need to step up testing, that labs were not being used at their full capacity, and that the supplies were there. Obviously, you can't state what other states are doing, but can you talk about
Sure.
that as it pertains to Pennsylvania?
Sure. So, I mean, if he means our state lab, we are doing that. So we are increasing the number of tests we have per day from our state laboratory as well. The state laboratory in Exton does priority testing. So, for instance, if we have an outbreak we're concerned about in a nursing home, we will prioritize that testing. We get it done in 24 to 40 hours, usually 24 hours. In the future, if there is a school that we're concerned about, then we can prioritize that get the testing, get it done in 24 hours. If a hospital needs extra testing, if we have, for instance, first responders who might need rapid testing. So we prioritize testing through our lab. In addition, the Philadelphia County Health Department and Allegheny County Health Department have laboratories, and so we'll work with them to try to increase that capacity. And we have reagents right now for our state lab and those county labs. When you're talking about the hospitals, however, we do not have reagents to give a hospital or a health system for their platforms. We do not have any stores of reagents. The only reagents that we have for the Pennsylvania Department of Health is for our state laboratory, and right now we have capacity. But they have some different platforms, and we don't have those reagents. We have called the companies, and we've called the federal government, and we'll do everything we can to try to source those reagents, but that is really controlled much more by the federal government, and they have certain priority states that have had enormous outbreaks that they are concerned about, and we know that they have priority in terms of LabCorp and Quest results going to those states, as well as reagents going to those states that have been particularly challenged, and it has kind of varied which states. So we're a little at the disadvantage because we've done better. Because we've done, through all the efforts in the governor's leadership, we have done somewhat better than Florida, Arizona, Texas. Right now, there are challenges in Tennessee and Missouri, of course, California. And so it's hard to get on that list to get the results back and to get those reagents. But we certainly have no stores of reagents.
Dr. Levine, you have to forgive me if you've been asked this before, but how accurate are the PCR tests?
Sure. PCR tests are very accurate. They're very sensitive and they're very specific. There are different PCR tests, so each one is slightly different in terms of, whether it's 90% or 92%. Sensitivity is looking at the false negative rate. Specificity is looking at the false positive rate, and we look at both. So the PCR tests are very accurate. They are the gold standard of what we're looking at.
The reason I ask is because I have been given a specific example, and I talked to the individual who had taken 2 tests on back-to-back days, had gotten 1 positive the day before, the next day had gotten a negative. So there was a concern there, obviously, about a false positive, and then my question from that is, not only would, I'm assuming that be a concern for you, but how much of a concern is that those false positives then get counted towards Pennsylvania's case count, which then alters our mitigation efforts?
Yeah, I think the false positive rate is very low. But I mean, no test is perfect. It also can vary depending upon how the sample was obtained, and then how efficiently the sample was processed, et cetera. So there are a lot of variables that can determine that. But using the PCR test, which is what we use for confirmed cases, every state's in the same boat, and we're confident about that data, and generally about the accuracy of the test. There can always be false negatives and false positives with any test. Yeah.
Pennsylvania has had a lot of challenges compiling data about race and ethnicity for these cases. What strategies now with the partnership with Walmart are being put in place to get this information?
Well, so we are working that all the time, and we have, of course, the Lieutenant Governor's Health Equity Task Force. We have our own Health Equity Task Force through the Department of Health, and they collaborate with the Lieutenant Governor's program. And we are working every day to try to get race and ethnicity, as well as what is called SOGI data, sexual orientation, gender identity data, on those tests. We're running about 60% for race now, which is better than it has been, but it's not good enough. And we have to continue to work with everyone in that process, the person that's ordering the tests, the people that are doing the tests, to try to get that data. And we're making progress, but not fast enough.
Are there specific strategies, though? How do we get that?
Sure. Well, one is that I ordered it. So before it was sort of expected and recommended, but then a number of months ago, I actually ordered that we had to have all that data. And then for the testing locations and the hospitals or whatever that aren't filling it out, we contact them and we work with them to try to get that data in there. But it isn't something we can just do. We have to work with all of our stakeholders to accomplish that. I think you had a question.
For the governor.
Yes, please.
Governor, we are still getting reports of people who have not gotten their unemployment money 4 months into the pandemic. What do you say to them, and is Pennsylvania doing worse at this than other states?
I think we're doing better than most other states. That's the information I get. We continue to hire more people, invest in new technology, but you're absolutely right. If there's one person out there who hasn't gotten their benefit on time, that's a problem. I think we're at 93% of the people have, but that's not good enough for me. So we're continuing to work. We have doubled the number of people on the call centers. We're hiring more people. We've invested in technology. We've worked hundreds of thousands of hours overtime, and we'll continue to do that. But we acknowledge that we have work to do.
Can I do a follow-up?
Yeah.
Rural communities are concerned with their internet now that instruction is going to go online, and they're concerned that they don't have that access.
Right.
Is there any federal money that's earmarked to help them out?
Not yet, but I'm working on that. And that's, by the way, what my Restore Pennsylvania plan was for. One of the key things was to bring broadband to rural areas, and I went around the state, as you recall, and talked about that. There's an effort right now that obviously the federal government, the administration has talked about infrastructure, including broadband, as something they want to do. There's been a resurgence of that now. I don't think there's anybody who disagrees with this, and for the reason you just pointed out. And it's not just education, it's telemedicine, it's economic development, it's GPS to be able to drive autonomous vehicles. It's all the things that agriculture depends on the internet. So we need to make sure that remote areas of this state and the country have access to broadband. And I think COVID-19 just reinforces, for so many different reasons, telemedicine, education, and others, how important this is. There's currently an effort that is being led by a public-private sector. I sent a letter co-signed by a number of other governors, Republican and Democrat, to the Congress and the administration asking to move forward aggressively with broadband. I was on a governor's call yesterday, and other governors around the country are calling for this, Republicans and Democrats.
We have time for one more.
Let me just, one of the, there are three things, I mean, in addition to trying to do a better job of getting more and more testing, there are three other things that I want us to be above average. We're number 9 in terms of the number of tests. We're actually the 5th largest state, so we're below average. We on a per capita basis, however you want to measure that, we need to do better. So we are working to be like Lake Wobegon, above average. Two other things. We want to make sure that the tests, we get the turnaround in a reasonable time. 2 weeks, that's almost useless. And so we need to have a fast turnaround time. And the third thing is we need to have tests that are easy to administer. I don't know if anybody else winced when you saw how you do a diagnostic test now. It's painful if it's done right. And so an oral test, a swab that you can almost do self-administered, we can turn around 15 to 30 minutes. That's the holy grail in terms of testing. So in addition to wanting to do more of what we have right now, I think we have pretty good confidence in what we're doing. Nothing's perfect, but we need to do better in terms of getting above average for Pennsylvania. We need to do a better job of actually turning test results around, however we do that, and we need to, I think, do a better job in terms of creating a sense. Yeah.
You mentioned how difficult it is to self-administer. Do you have data on how, is it any worse or any better, as comparably good as having a nurse or doctor do it, as opposed to having people sitting in a car doing it themselves?
I can tell you, I'll give you my impression. If I were administering it myself, I'd feel a lot more comfortable than, I have not been tested, but I think I'd feel more comfortable doing it myself than have somebody else do it.
You still have not been tested, though.
Huh?
You have not been tested.
I have not been tested. You want to? Sure. Do that.
So there's, as the governor mentioned, there's varying forms of swabs. So there was nasopharyngeal swab, which is a longer swab initially. Most of the tests were conducted that way. You saw a mid-turbinate example, which was shown in the video. So about half the distance of the original swab, and now it's an anterior nair. So it doesn't go in as significantly as the previous types of testing, which makes it much easier to collect the sample. Again, easy for administer from a patient perspective. To the governor's point, for myself, I would rather administer it myself, but we do want to maintain the quality of that, and that's why we ensure that the pharmacists who are trained in doing the assessments, or wherever healthcare provider is ensuring the accuracy of the test and the sample that's being collected. So it has gotten easier and evolved over time, and hopefully it continues to get easier as we proceed.
One more question.
Mine's for Dr. Levine. We've heard a lot of educators at the PA House committee hearing, education committee hearing, about when a teacher or student or someone tests positive, how they will contact the Department of Health. But they don't really know what goes on from there. They're looking for more metrics as far as if, you know, who's going to have to quarantine, when a school will get shut down. What do you have specific metrics when it comes to that?
So we are working on those specific type of guidance recommendations, which will be data-driven, and we'll be releasing them presently. I don't have a date, but we are working on exactly that, and we'll be releasing it when it's ready.
And do you have any update on the PIAA guidance with allowing parents in those stands?
Governor, would you like to comment on that?
Yeah, the guidance is that we ought to avoid any congregate settings. And that means anything that brings people together is going to help that virus get us. And we ought to do everything we can to defeat that virus. So anytime we get together for any reason, that's a problem because it makes it easier for that virus to spread. So the guidance from us, recommendation is that we don't do any sports until January 1st.
Thank you, everyone.
Thanks a lot.